Bladder 1 is located one fen medial and superior to the inner canthus of the eye. If a person scrunches up their eyes, a nice depression forms here, and that's where you're going to find bladder 1. Bladder 2 is located in a depression at the medial aspect of the eyebrow. Palpate along the supraorbital margin until you locate a nice dip at the medial end of the eyebrow. That's your bladder 2. Bladder 6 is 2.5 cun into the anterior hairline, 1.5 cun lateral to the anterior midline. Gallbladder 12 is found just a few fen anterior and inferior to the extra point peaceful sleep. Gallbladder 15 is located at the midpoint between Do24 and stomach 8. It's 0.5 cun into the anterior hairline. To locate Sanjiao 20, press the ear against the side of the head. The point lies directly superior to the apex of the ear on the side of the head. Sanjiao 23 is located towards the lateral end of the eyebrow in a nice dip on the supraorbital margin. If you palpate towards the end of the eyebrow, on most people you'll find there's a nice cleft in the bone. Do28 is located inside the mouth at the upper frenulum, at the junction of the upper gums and the lip. Gallbladder 29 is found midway between the anterior superior iliac spine and the greater trochanter. To find the greater trochanter, palpate up the lateral aspect of the leg until you find the bony protuberance at the top of the femur that is the greater trochanter of the femur. Gallbladder 29 lies halfway between these two landmarks.
Kidney 14 is on the lower abdomen, level with Ren 5, 3 cun superior to the symphysis pubis, 0.5 cun lateral to the midline. Sanjiao 1 on the ulnar nail point of the fourth finger. Going to be feeling for the flare of the bone, looking at where the ulnar and proximal borders meet, looking at the nail bed, and putting my point in. Sanjiao 2 between the fourth and fifth fingers, 0.5 cun within the web margin. So bring the two fingers away from each other, feel for the flare of the bone of the fourth, and come out into the margin between those two bones. So Sanjiao 3 is on the dorsum of the hand, proximal to the 4th and 5th metacarpal phalangeal joint. Locate this with the hand in a loose fist. Run your finger over the joint head in between the 4th and 5th bones. Just wiggle the fingers to make sure that you're not on the bone, and popping your point in. Small intestine 1 at the ulnar nail point of the little finger. I'm going to feel for where the flare of the bone is. Look at where the nail bed is. Look at where the ulnar and the proximal borders meet. Put my point in, and there it is.
Small intestine 3 is on the ulnar aspect of the hand. It's in a depression which is proximal to the head of the 5th metacarpal. It's in between the metacarpal bone and the muscle, and it typically lays on a level with the distal palmar crease.
Kidney 10 is at the medial end of the popliteal crease, in between the two tendons of semitendinosus and semimembranosus. Locate this with the knee slightly flexed. Kidney 10 can also be found in the prone position. To bring the two tendons of semitendinosus and semimembranosus into relief, you can ask the person to push up against your hand against resistance. This will bring the two tendons into relief, and you can palpate in between them easily.
Gallbladder 40 is located approximately at the junction, the line drawn along the anterior and inferior border of the lateral malleolus. It's important to articulate the foot and feel for a nice depression here. Mark your point in the deepest part of that hollow. Bladder 67 is the lateral nail point of the little toe. Be sure to mark it clear of the nail bed.